have stress and then you move sufficiently, the impact and the likelihood of low back pain would be minimal. And yoga, stretching, but also running and bouncing and climbing and playing with children under the table. So more animal movements.
Hello, everyone. I'm here currently at the Fascial Research Congress here in New Orleans, 2025. And I'm here with a very special person, and he's the foremost fascial research person. And I give you Mr. Robert Schleip. Good to see you again, Robert.
Thank you. I need to contradict you right away. I'm one of the people worldwide, so I'm part of a very rich network.
But it was an honor to be with Robert right now. Actually, we were part of a dissection experience
yesterday.
And it was my first time, and I'm glad I didn't pass out.
It was a rich experience.
It was it was special, very special, especially that experience. Gil had us hold the heart of the person. So that was very special. It was very memorable.
So you touched it too?
Yes.
Nice.
But it was life-changing for me.
Yeah.
So just to give you a brief background about me, Robert, I used to suffer from back pain. And I was diagnosed to have surgery. I had spondylolisthesis. So in the X-ray it shows one of my vertebrae shifted. And luckily I decided to look for another alternative, which is Pilates. And that was 20 years ago. So I've never never had back surgery. And I read in your book how you mentioned the fascia has a lot of sensors. Yes. So can you?
So in many cases, it could be a contributing factor, if not the main contributing factor. In some cases, not all cases of low back pain.
Yes, because in my mind, I saw my bones shifted. And surgery, and an authority figure tells me surgery. It was a very difficult to.
And luckily, you chose a different pathway.
Yes, I'm glad. And and you mentioned about, in one video, he said, I heard you mention that swimming is for fish, flying is for birds, and walking is very important, right?
Walking and running seems to be what Homo sapiens has been optimizing. Not the only thing, but that makes our body be specialized. So if you compare us with penguins, if you compare us with birds,
we don't walk like this, like penguins,
or with chimpanzees, a lot of the differences have to do, not all of them, but our long legs and many other features, and the more sweat glands on our body, they have to do that. Some of our ancestors, they survived because they were better runners and also better walkers.
I think they're better runners to survive.
And we inherited our body, and we don't run enough, at least not in childhood.
So how does my question is, how does fascia contribute to the experience of back pain, would you say?
There are some strong indications that we have a lot of nociceptors, free nerve endings, that can be a local source of soft tissue pain. A lot of them are in the lumbar fascia, and they are also more sensitive than if you stimulate with the same method the muscle fibers. So they are more sensitive, they are quite dense there. And we also know that the lumbar dorsal fascia in low back pain patient is more adhered in certain regions. So if you take that together, it's a strong indication, but not an ultimate proof that pretty frequently, I don't know if that's more than 50% of low back pain cases, but in a significant amount, that could be the primary or a contributing factor.
Like recently you've been mentioning about emotions, how it affects also our fascia. And I remember I had back pain back then because I just moved to the United States with my son, 4-year-old son. We have no job, no income.
Typical.
So
Yeah.
it might be, I was thinking it might be, I was in a lot of stress at that point.
Yeah.
And my
And then you have back pain. But lucky you
Yes.
didn't keep it.
Yes.
So for some
thankfully.
people, it's a change in their life, and then they have chronic low back pain.
Correct.
Yeah.
And,
So you had a different
yes.
history and
Thankfully.
yeah.
So, in
but
terms,
probably your Pilates helped you, or was that before
yes,
you got
thankfully, I think I have to change paradigm in the way I train, because I used to train, typical. You want the mirror muscles, bodybuilding, lifting weights.
And then you change your approach.
I changed my approach, working more from the inside out, like local stabilizers instead of.
I'm familiar with that concept.
So you've done Pilates yourself.
Yeah, sure. Yeah.
So it's just being even mindful of the way I train. So instead of you put music, but really feeling the muscle, and so that really helped me connect with my body more interoceptive.
Yeah. So the Pilates concept and their emphasis on the inner muscles, for example, the transverse abdominis. And today we heard it again, how strong the transverse abdominis connects to the most important layers of the lumbar dorsal fascia. So the Pilates work that you do could be contributing to prevent low back pain.
Yes, thankfully. And breathing is important too, right?
And maybe our ancestors who were hunting to get animal food for their family, they wouldn't need to do Pilates because they have enough activities
I know.
in which the transverse abdominis is activated. But for a couch potato today, the transverse abdominis and other inner stabilizing muscles are not adequately strengthened and utilized.
Especially our breathing changed too, being on the computer all day. And I had to tell my wife upstairs, let's walk around.
Sure.
Stop just being in the computer.
Sure.
If not, I'll end up massaging her neck again.
Sure. You have the choice.
So how do you explain the role of fascia restriction in back pain development? Is it more lack of mobility, a lack of activity, or is this more in the inherited a bad posture?
So I was sharing yesterday the study of my colleague Andreas Bandel, and he observed himself for full months on which days he had more adhesiveness in the lumbar dorsal fascia, and where it was much better. And he looked, does it correlate with heart rate variability? That's the balance between sympathetic stress activation and relaxation in the autonomic nervous system, but also with stressful events. And that study showed that 48 hours after a stressful event, the lumbar dorsal fascia was adhered.
Oh my gosh.
He didn't measure back pain, but adhesion. But we know from other studies that in low back pain patients, you have more adhesiveness. That doesn't mean the adhesiveness is the only cause, but they seem to be associated with it. So I think stressful events can be a contributing factor to it.
I watch my HRV now. So
Sure. And
but I have enough sleep.
But in addition, I think the lack of appropriate movement, that is an additional factor. So if you have a stressful event, and after stress, I usually move more limited for that time. You don't walk with a big arm swing, but maybe if you have stress and then you move sufficiently, the impact and the likelihood of low back pain would be minimal.
Luckily, I'm a Pilates instructor now.
So you teach to other people.
I exercise all the time.
But if you become a YouTube Pilates instructor, so you can share about your low back pain.
I know, right? What are other modalities that you do to keep you moving? Aside from what exercise do you do? You're in great shape.
Thank you. So I try to do multidirectional movements,
Okay,
and also to not do too much monotonous movements. So I try to change, to do a new movement dance every couple of months, or to explore a new modality. So and yoga, stretching, but also running and bouncing and climbing and playing with children under the table. So more animal movements. So where you're rolling on the floor, where you're hanging in the trees upside down. So I think anything that we miss in everyday life.
Yeah, it's just like our ancestors.
Yeah, sure. Yeah.
So I started a martial art called jiu-jitsu.
Oh, there we go. Yeah, so you are rolling on
I'm
the floor.
rolling. We have to roll.
Yeah.
We have to walk, crawl, and grapple, and fight or flight.
Yeah. And next life, I want to be a monkey. I want to swing upside down. And
just to make it play and fun.
So in Germany, it's allowed as an adult to go to a children's playground.
This is
in America, you should watch out. You know, the parents, they call the police. It's a strange guy. But in Germany, you can do that. It is good to do it when there are not too many children, because they want to. And then you can hang upside down in weird positions.
I was wondering, because I didn't grow up here. I didn't know that it was.
Sure.
That was the mentality. So when we travel, I look for a playground to do my pull-ups.
Yeah, there we go. Yeah.
But they were looking at me strangely.
Yeah.
That's the reason why. So,
So maybe the trick is you put on a tripod with a camera. And then they think you're one of the fitness instructors.
Okay, there you go. So what's next, Robert, for your path in your journey?
I don't have a fixed direction anymore.
No more.
So for many years, it was my priority to explore and to publish the active contractility of fascia that we did. And that was the most important thing in my life, but that is done now. So now everything else for me is fun and play.
That's good.
And I like this conference very much. Because I watch people that I used to inspire many years, how they have taken the work much further, and they are showing me things so where I feel like, wow, I never anticipated it.
It's nice to see the future.
And that is the style of this conference. So people show each other things and learn from each other.
It's very collaborative.
And you go in a lecture with somebody who is doing animal fascia. And then a surgeon.
Yes. But it's amazing. It's to see the young people just rising up and taking it to the next level. It was really life changing just to be part of this Fascial Congress. I'm glad it's not in another country.
Oh yeah, sure. But every 3 years, if you.
But so we took advantage that it's in the U.S.
Yeah, but thank you for your work to bring fascia orientation into the Pilates work that you're doing there.
Yes, so it's really helpful, very helpful for us. So I'll bring back to all my staff what I
Please do.
Yeah, but thank you so much, Robert.
Thank you.
For your time.
Yeah.
Just the opportunity to be with you and. In the dissection as well. So.
Thanks.
Appreciate it.
And see you again in the future.
Yes. Do another Fascial. But thank you so much for joining our video. So till next time.
So I say it so you have it on proof. So you can use the interview. You don't need to send it to me before.
Oh, okay.
So that saves you time and me.
Oh, okay. Thank you.
Because I didn't make any bad jokes.
Okay.
Thank you.
Thank you, Robert.
Thank you.
Thank you. Appreciate it.
Well done.